You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Wow, big topic today. What you need to know about breast surgery, all new shows. We have a board-certified plastic surgeon that considers himself an artist. And he said, Randy, take a look at my work. Because now, I interview surgeons nationwide. This is not a direct endorsement for the doctor you're about to meet on the program. But I will tell you, probably the best work that I've seen. Very natural results. And he is a perfectionist. So if you are unhappy with your breasts, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the Wellness Hour, the most watched medical television talk show in the world. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. Big topic, hot topic. With us we have board-certified plastic surgeon, artist, Dr. Mo Zachary. Dr. Zachary, always a pleasure to have you on the show.
Thank you, Randy. Good to be here.
Now, before we get into today's topic, I always feel like everybody knows you, but for those that don't, tell us a little bit about your background, your training, and CSI.
Okay, I did my general surgery training at Harbor UCLA, which is the county hospital for the UCLA system. And then I did my fellowship at the University of Utah in plastic surgery. Okay. And then they were kind enough to ask me to stay on. They recruited me as a staff member. So I was on faculty there for almost 5 years as a professor of plastic surgery. I taught the gamut of plastic surgery to medical students and residents and fellows.
Do some guys have it and some guys don't? By the way, as far as an aesthetic eye to make something look beautiful?
Yeah, you have the guys that are very academic and they stand there and they draw lines and they mark the patient, and then you got the guys that sort of freehand it, and they have a vision and they can make it
look the way they want it to.
Yeah, and then I was recruited to the desert, and I eventually joined Dr. Ball's practice at the Cosmetic Surgery Institute.
Big place, big place.
It's a 6,300 square foot building. We have 2 operating rooms which are double certified by different accreditation
so it's
bodies.
Safe. I mean, safety is big on your list.
Absolutely. We don't skimp and we don't cut any corners.
Now, you do everything there, by the way. We're having you on the show talking about breast augmentation or breast surgery today.
Right.
But I mean, you have IPLs, you have lasers, you do fillers, you do everything.
You bet. We have a full gamut of lasers. We have 2 very talented estheticians.
Yeah.
And we have a wonderful laser nurse, very, very knowledgeable about what she does. And we have a great injector nurse, Peggy, who does Botox, Restylane, you name it, she does.
Okay, breast augmentation, breast surgery, what are the different categories?
It's a very interesting thing. In our practice, we have the younger patients who come in for breast augmentation. They're smaller and they just feel like they want to balance out their body. And then we have a little bit slightly older patients in their 30s who have had some children, and now because of breastfeeding, their breasts have fallen, so they want to fill it back up.
So breasts have become more mainstream. People that I guess were afraid to do it in the old days or wouldn't do it, swore they would never do it,
right?
Are doing it.
Absolutely. And I think what happens is all the controversy has settled down with silicone
controversy
implants.
About what? Oh, silicone.
All the silicone, hubbub that happened. The silicone leaking and things like that.
We had a silicone implant on this show. They cut it. The surgeon cut it.
Right.
It doesn't come out.
Absolutely.
Is that?
And that's the key.
People don't know that. I
guess.
Because
the silicone particles have actually been bridged by extra oxygen molecule. So all the silicone is clumped together. So the leakage has been taken out of that factor. Even if, God forbid, I always tell my patients, if you get involved in a car accident, you hit the steering wheel or airbag deploys, hits you, and your implant cracks under the pressure, you'll never know it because that silicone doesn't leak. It stays right there. So it's very important.
I asked you right before we went on, what's the percentage of patients do you do silicone over the, what do you call the other, by the way?
Saline.
Okay.
Saline.
And you said 99%.
Water implants. 99% of our implant breast augmentations now are with silicone. And the things that I tell my patients during consultations, the patients haven't heard anywhere before. I mean, I really open things up for them. I take them to the next level. And we have a lot of patients that come and visit us from all over the country. And they come back a year later, I've gone to the best breast augmentation surgeon, on the East Coast, on the West Coast, in Canada, here, there, and I'm back to you. A year and a half later, everything that you told me makes sense. I went and did my research.
There is a lot of art to it because I'm still skeptical. I still feel, after, on our show airs nationwide, we're in Canada, we just launched there, but it seems a straightforward procedure.
Yeah,
but it's not, you're saying.
Well, you know, it's so funny that you mentioned that, because all my friends, they're like, oh man, you've got the best job, you know, you just go in and put in the implants, boom, you're done, you know, and you can go home or go play golf or whatever.
Yeah.
No, that's not true. You know, what happens is there's a lot that goes into these implants, and there's a lot that goes into the art of it.
The design.
The design of it.
To make them even.
Of it. Absolutely.
You say you sit people up to see how they fall.
Right.
Is that right?
During our consultations, the first thing that I do is, you know, I go in and introduce myself to the patient, and then they change into a gown. And then Becky and I, our patient coordinator.
I've met Becky. That's right.
She comes in with me, and her and I, we have a very good eye now for the patients, and we try to balance the shoulders to the hips using the breasts. So
as far as size?
Right, as far
Okay.
as the size of the implant. So we actually have special bras in our practice. We have them put on a special bra, we put in sizers, and then we have them put on a tight-fitting shirt. And we have them try on the size, and then whatever size they like or their husband likes, you know, we usually tell them to come in.
Do they bring in with their partner?
Absolutely. We encourage them to come in with either their partner or their best friend or someone. And then we have them keep those implants in, and I really educate them towards all of their options as far as the type of implants, shape of implants, texture of implant is very important.
One of your friends, board-certified plastic surgeon,
I know
big
where you're
smile,
going.
you know who I'm talking about? He says to me, and he presented a convincing case, he says, Randy, I don't like silicone. He says, he says, number one, it's easier to put in the others, because I guess they go in and you inflate them in the breast. I didn't know that either, right? What's your response to that? Him saying, I think it looks better, it's easier for the surgeon, better than silicone.
I know, and he actually,
saline better than silicone.
And he actually says that saline turns out softer than silicone. I honestly think, you know, the
I mean,
thing
do you think he's wrong?
I believe that he is, in my opinion, and I'll tell you. And I'm not saying
I've
this
never been
behind
anybody
his
that
back.
You'll show him a clip of the show.
He and I have very honest conversations about this, and we get very passionate about the way we talk because we are perfectionists at our trade.
Okay.
I think that there's a geographic phenomenon going on with implants now. On the West Coast, we tend to be ahead of everybody else in the country. And so I think we're 5 years ahead of everybody else in the country as far as silicone
He
implants
did say they
are
weren't
concerned.
ready out there where he's
Exactly.
from. Okay.
Nevertheless, I think it's going to catch up. But there's all these little intricacies that you have to point out to the patients and you have to explain to them. Now, to get back to your original question, there's 4 ways to approach the breast. You can go in through the belly button, you can go in through the armpit. I think those are really silly gimmicks that you see on, I don't want to say, but you see on plastic surgery TV shows.
Yeah.
You know,
Hate those shows.
We're
No
operating here. Yeah.
The only good show on TV, by the way, I always tell people,
Is the Wellness Hour.
right?
Exactly.
Yeah.
Well,
Anyway.
you know, we're operating here. I don't have, as a good surgeon, I don't have any business dialing long distance. Surgery is very traumatic to the body. It causes a lot of scar tissue. As a good surgeon, I want to go in and out of the body through the shortest route.
So where do you go?
I like to go under the pec muscle. To go under the pec muscle is very, very important because the pec muscle up top here is very thick, okay? So you want to put the top of the implant under the pec muscle so you get a very nice clean tapering of the breast. What I hate is where the chest wall comes and then boom, the implant comes like this, like a coconut on the chest wall. And then the other thing is that from a medical standpoint, it's very important to put the implant under the muscle because of mammogram reasons, right? Because you're bypassing the breast tissue, you're putting the implant under the muscle. In essence, that muscle is pushing up that breast tissue, opening up that breast tissue so that the radiologist can effectively read the mammogram.
So are they still putting them on top of
Yes,
the muscle?
absolutely.
All the time?
All the time. And I don't really understand why, you know, doctors do that.
You really don't? Okay, believe it or not, we're going to take a quick break. We come back, some of these photos of your work, and we'll go from there. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you're considering any type of breast surgery, my advice, stick around for the next segment. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. With us, we have board-certified plastic surgeon, the doctor that's considered the go-to guy for a natural-looking breast. Is that what you're trying to do, get a natural look?
Absolutely. I always tell my patients if I do my job well, we balance the shoulders, tie in the shoulders to the hips. What happens then is, because you have to understand, when you meet somebody for the first time, whether you realize it or not, you're judging them from head to toe. And so the worst thing is for somebody's eyes to get stuck at the breast. What I like to do is, if I do my job well, the body flows well in symmetry, and the waistline really comes out. If you choose the right size implant for somebody, you know, everything flows.
Is it true, though, that the biggest regret is women, they didn't go big enough?
Yeah.
Does that happen, or
I think,
not in your practice?
You know, I think it's a lot of times what happens is breast surgery is a very emotional surgery. And so patients always get this, for the lack of a better term, I call it buyer's remorse. They come in for the first 3 months and they're like, oh, I should have gone bigger, I should have gone bigger. And I just tell them, you know, relax, your mind's eye is getting used to your new body, so just relax and go
good point.
with it. But, you know, the main danger that you run into as far as going too big is you don't want to make somebody look matronly. If you make them look matronly, then they look top-heavy and they actually look fat.
They could look heavier in the wrong clothing.
Yeah, absolutely. And then the second danger, not as much as going too big, is going too small. If you go too small, especially if the patient has dominant shoulders, then the shoulders swallow up the implants and they don't feel like they've had anything done. So it's very important to size them properly and just go in the right size. Now, you know, don't get me wrong. I get patients that come in, they say, well, you know, I'm in the adult entertainment industry, or, you know, whatever, you know, I need to go bigger. Okay, fine. You know, if you're sure that you want to go bigger, you know, let's go bigger. However, safety is of my main concern. You know, once you get past a certain size, like 500 cc's and things like that, then you start running into very heavy breasts. You start running into the size of the breast affecting the shoulders, the neck, you know. And then I always look at my patients, you know, what size heels are they wearing, how tall they are, how much they weigh, and also, you know, I ask them about their activities. Do they ride horses? Do they ride ATV? Do they like to jog? You know, are they athletic? And you know, things like that. Issues like this are very important. They have to be taken into account.
Okay. Now, you have photos. What are we looking at here? Are these all augmentation cases?
These are all augmentations. Some of them are mommy makeover augmentations. Some of them just straightforward augmentations. I think I just kind of want to show you a different flavor of different patients. You know, a lot of times when the moms come in, they feel like their breasts are deflated. So, you know, we just put in implants. For example, this mom, she just felt that her breasts had been deflated after breastfeeding.
Now, when I look at this before and after, it looks like the woman has more cleavage. Was that something you did?
That's a very good question. I always explain to my patients, you know, the breasts have their personality. We're not changing the personality of the breast. We're not changing the personality of your cleavage. We're just making them bigger.
But can you add cleavage? I mean, you've said in the past shows you can.
Right. You can add cleavage, but it's very tricky. What you have to do is you have to base this surgery on the nipples. The nipples have to end up dead center on the implant, okay? So the mistake that some surgeons make is to actually move the implants in to give more cleavage, but then the nipples end up on the side, okay? So that's a no-no.
So in pursuit of giving cleavage,
right,
the nipples end up on the side.
Yeah.
So what's the answer then?
The answer to that is to actually come in at the same time after you do the breast augmentation. At the same time, take some fat, harvest some fat from the abdomen or the hips or the flank area, and take some fat and harvest that fat and then graft it inside the breast.
Is that common? You're doing that now?
The cleavage. It's not common, but we do it. We have great success.
Do you know other people doing this, by the way?
No, not in California.
You're going to write a paper on it one of these days?
No, I used to write a lot of papers when I was at the University of Utah, but I'm just
too busy now.
Busy right
That's
now.
the problem when you're a busy guy. Okay, so cleavage, you can do something about cleavage.
Absolutely.
Okay,
absolutely.
because I'm always told, and I have a lot of guys on the show that say, well, Randy, there's nothing you can do about cleavage.
No, there absolutely is. Now, you know, the one thing that I want you to notice on this side view or the oblique view is I want you to notice how I was talking about the tapering off the chest wall. The implant tapers off the chest wall. That's because we've put the implant underneath the pec muscle, and the pec muscle brings up a very good layer of thick cushioning tissue. So the implant actually just kind of tapers down to the nipple area, and then it falls into a semicircle. Very soft, very supple look. It looks absolutely natural, and these patients have great results. Actually, most people do not, most of their friends, female friends who see their breasts in the dressing room and whatsoever, they never know that they've had a breast augmentation, which is very important. The incision 90% of the time falls into the breast crease. That incision heals, becomes part of the breast crease. 6 months later, you can't even see it. Now, Randy, let me tell you this. I did tell you that you cannot change the personality of the breast. That's not really true. You can tweak some things.
What do you mean personality? I'm not sure what you mean by that.
The shape of the breast, most of the time, it is what it is. You're not going to change the shape of the breast, but sometimes you can. For example, let's pay attention to this lady's breast. If you notice, the nipple to the breast crease distance on this lady is very short compared to the last patient. Okay? So the nipple is actually sitting lower. All right? If I, as a good surgeon, know what I'm doing, I know how to tweak that to where afterwards, when we put in our implant, the nipple to the breast crease distance on this patient has doubled.
So more of the space from the bottom of the nipple to the...
Exactly. So it lets the breast bottom out a little bit more, okay, so that these patients do have that same result that I was talking about, very soft, supple. You get a very nice soft tapering of the chest wall, okay, into the implant, then the nipple, and then you get that half circle, okay? It's very important. If this patient goes to a surgeon who is not that experienced, what happens is, because of the surgery, their nipple to breast crease distance stays short, okay? And these patients end up with the implant getting stuck up on the chest wall, right? And their nipples end up pointing down. Now,
it amazes me that there's so much to this.
Exactly, and you and I talked about this off camera, and you asked me that question. Now I'm explaining to you, what happens.
Because I've seen some breast augmentations from other surgeons where the nipple ends up very low.
Where the nipple ends up pointing down.
And I asked you, how does that happen?
Right. And the nipple is actually supposed to point straight. It's not supposed to point low. It's not supposed to point up. It's supposed to point straight. Very important. Okay.
We're just about out of time. We have time for a few more.
Right. Now, this patient came in, Randy. She had children. She had breastfed.
No, they look good, by the way.
They did.
That
you know
looks
what?
like an
The
after
shape
photo.
of these breasts looks great. The problem was that after breastfeeding, she just felt that her breast just felt a little bit flat. This patient actually had gone to someone else, and they had tried to get her to do a breast lift. A breast lift will put an upside-down T-scar on the breast, okay? And, my motto is let's try the most conservative way first without putting extra scars on. If it doesn't work, we can always do a lift. I felt pretty confident that I could do an augmentation on her without making her go too big.
This was not a past augmentation?
No,
These were her own breasts?
This is her own natural breast, and she had a little bit of kind of a ski slope on her chest. She wanted to fill that out. And
it's a subtle change.
Exactly, and she wanted to give a little bit of a lift, okay? We've given her nipples a little bit of a lift, okay, and we got rid of that ski slope, that women hate on their chest, okay? We give her just a little bit of a lift. Okay, now this young lady came in. Her breasts were a little bit uneven. Her left breast, the nipple was a little bit lower, okay? You can see on the picture, there's distance on the nipples is off. And also, both of her breasts, the nipple was also a little bit lower on both sides. The nipple to breast crease distance.
One is kind of bigger, by the way, than the other.
Exactly, and we had to make up for that too. Size-wise, we made up for that. Afterwards, after the surgery, she looks absolutely symmetric. A lot more symmetry as far as the nipples.
They look very natural, by the way. I guess people
and they look very natural. Exactly.
So that little detail, so is one implant a little bit bigger than the other?
Absolutely. What we do is, not only do we size them in the room during the initial consultation, but we also do one final sizing on the operating room table. A lot of times, our body, the left side compared to the right side is off. It's just like when you go shoe shopping. You're always a half to a quarter size off. So it's the same thing. We size them, and they're always a little bit tiny off.
All right.
And if we feel like we can improve upon it, we do. Now, if you look at the oblique view, again, as I pointed out to you, the left breast, the distance from the nipple to the breast crease is off a little bit. The left nipple is a little bit lower. Oblique post-operative view, the breasts look absolutely natural. Very nice result. This young lady is absolutely happy. She went off to college. She's living her life. She's just fabulous. She is.
So they love the difference.
So happy because, that little asymmetry of her nipples was wreaking havoc on her
Is
emotions.
that right? So, if it bothers you, do something about it. Is your... Okay. Now, literally, we have probably a minute left.
Sounds good. The same thing here. This was a mommy makeover. This patient came in. She'd had 2 previous pregnancies. If you notice, the shape of her breasts were good. However, look at the distance between the nipple and the breast crease. They're a little bit lower before surgery, after surgery.
So the distance underneath the nipple.
Right.
Before.
The distance
after.
between the nipple and the breast crease.
It's like a lift.
Exactly. They look like they've had a lift. The nipples, the breasts themselves are perky. The patient is, once again, she is so happy because she has had exactly the result that she envisioned.
We're out of time, and I want to talk a little bit about redos and what you're doing for people that have had breast augmentation in the past. Maybe they want them fixed. So sum up augmentation. You say it's in the details.
Right. You know, and the problem at hand is that the patients think that it's cookie cutter, but the surgeons also think it's cookie cutter. 90% of surgeons out there think that breast augmentation is cookie cutter, and it is what it is. They tell their patients, sorry, that's the best I can do for you.
Yeah, because I talk to doctors, they say, well, it is pretty easy to do. I'd rather get more. I talk to you, and if you say, no, it's tricky.
It is very
tricky. To make
tricky.
it right, big difference.
The results that I'm talking to you about, changing the breast crease distance from the nipple, things like that, not too many people can achieve these kinds of results with breast augmentation, okay? And so that's what patients have to realize is they cannot just settle for mediocre results when they can have excellent results, you know? But the problem with patients is that they can go to 9 breast augmentation surgeons and they can get 20 different opinions, you know, and they come in and tell me other people's opinions and I'm like, oh my God. You know,
really?
It leaves the patients so confused, and it takes so much time then to sit down and re-educate them and actually, you know, and it makes me feel kind of bad because they've already had surgery. Now they're coming back for a second surgery. I'm having to fix them. So
you fix a lot?
40% of my practice in breast augmentation is reconstruction. Fixing other people's mistakes.
Redoing. And the number, let's say top 2 things, and we're out of time, top 2 things you're fixing, just the symmetry?
You bet. The symmetry is the first thing. Second thing is putting the implants, taking the implants from over the muscle, putting them under the muscle, and also capsular contracture. A lot of times when you put implants over the muscle, they tend to harden more.
So hardening breasts, you can deal with that?
Absolutely, by taking it and putting it under the muscle, because the muscle provides a natural barrier that's constantly massaging that implant, and it keeps scar tissue from forming.
And what is this
it.
technique? I told you about this gal. She says there's a surgeon in Beverly Hills. He does half under the muscle, part over the muscle.
Right.
What is that all about, and who's a candidate for that? And do you do that?
Yeah, absolutely. It again depends. You know, these are the things that I have to pay attention to and tweak. Like if I want to make a longer distance for the breast crease to the nipple distance, then I have to skip some of the muscle in that area, and I have to go under the muscle above the nipple so that I let the implant bottom out. So the muscle is pressing on top of the implant and it's pushing the bottom of the implant out to make that implant bottom out so that it makes that lower pole of the breast stretch out, right?
Okay.
Whereas if you have a patient who has done a lot of breastfeeding and they have hanging tissue, okay, then you have to put the implant all the way under the muscle so that the muscle hugs the implant, makes the implant right up high. If the implant is riding up high, then it takes that breast tissue from the bottom and it lifts it up. Okay. So there's a lot of intricacies, and there's a lot of.
And you're a perfectionist, you say.
There. Yeah. Oh, yeah. You have to be.
You think you're one of the best, by the way?
I do. I do, because it's my passion, and I mean I'm not vain or arrogant about it. You know, the thing that I have noticed is that I'm getting a lot of different referrals from doctors' offices. I get a lot of referrals from around the country.
Do people, by the way, see you on my program and feel like they know you? Do they go in and say that?
Sometimes it's unsettling because during the consultation I'm talking to the patient and they verbatim, they keep repeating everything I'm saying. They're like, oh yeah, I watched this on the Randy Alvarez show, and so some of them...
You tell them that's a good show, right?
Well, they know it's a good show because a lot of them have watched it 9 or 10 times.
Do they say that they watch it 9 or 10 times?
Absolutely. It makes me feel very good that I'm educating patients all around the valley.
Okay, so if you're not happy with your breast, do something about it, or at least get a consultation.
Yeah, I think the most important thing I can tell my patients is during the consultation, make sure that, first of all, your doctor's staff is kind to you because you're going to be dealing with them a lot before and after surgery. We're very, very heavy as far as our patient care after surgery. We see our patients a lot, and it's an open door policy. Second of all, make sure that your doctor has a good before and after portfolio. It's got to be thick, not 1, not 2, not 3 pictures, 20 or 30 pictures. That's so important. That's probably the most important thing.
You'll know them by their work.
Absolutely.
This is on these photos are on your website?
Some of them are, and some of them aren't. We keep trying to add on, each and every time.
So certain doctors tell me, Randy, I just don't have a bunch of before and after photos. I don't get them, this and that. You think that's an excuse? Because you have hundreds.
That is, that would be unsettling.
Like a red flag?
Yeah.
Would you say? Mm-hmm. Okay, so board certification, very important to you?
Yes.
Okay, look for an artist, look at their before and after photos, and make sure you get along with the surgeon.
Yeah, and that's probably one of the more important things. Just make sure that you get along with your surgeon. Make sure that you can have an honest conversation with your surgeon instead of them talking down to you. You got to be able to ask your surgeon.
Do they do that though? I mean, certain doctors are accused of talking down.
I hear that from other patients. That they their physician was
like arrogant,
and they didn't appreciate.
Nobody says you're arrogant. Everybody says you're a nice guy.
Thank you. I try to be.
All right. Well, thank you for coming on the show. Very good.
Thank you so much, Randy.
Always a pleasure.
Always good to see you, man.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.